In Chapter 25, Infections of the Circulatory and Lymphatic Systems, we are going to pick just a few important diseases to focus upon. There are a couple of reasons for that, but the main reason is infections of the blood specifically can really cover a wide variety of infections because the blood is going to be the way a lot of infections transport through the body. So moving into this chapter, let's take a very quick look at the anatomy. With the circulatory system, we are looking at the different methods in which the different ways that blood can travel through the body. So these may be infections of the heart or infection of the veins and arteries that travel through the body. The lymphatic system is another system of tubing that travels through the body that allows us to filter any liquids before we dump into the blood. One of the most important things we'll talk about in this chapter that you may need to do a little anatomy review on is the lymph node. Lymph nodes are some of the little concentrated filtration sites within the lymphatic system. So a little bit of terminology before we move too far. Septicemia, this is going to be the presence of pathogens or toxins in the blood. When sepsis occurs, that's when you see the pathogen in the blood plus some inflammation. And then we may end up with a septic shock. And I apologize, the picture's a little bit in the way. But with septic shock, we're going to see a huge drop in blood pressure. So let's take a look at some of the important infections we need to cover in this chapter. One of the first I want to talk a little bit about is toxic shock syndrome, or TSS. The reason I want to talk about this is because it is caused by Staphylococcus aureus. So we see this same bacteria appearing again. This particular type of infection is going to be seen in women that already have a little colony of Staphylococcus aureus living inside of the vagina. But when we have patients that already have this population, leaving tampons or contraceptive sponges, something like that, in the vagina too long, we'll see an overgrowth of the Staphylococcus aureus. This can actually be extremely dangerous because it leads to a rapid onset of low blood pressure, which is what we were talking about in this last slide, this septic shock. So there have actually been people that have died from this overgrowth of Staphylococcus aureus simply by not following instructions. So I do think that is an important point to make since we're seeing this same bacteria pop up again in another chapter. Endocarditis is infection of the internal layers of the heart. The most common cause of endocarditis that is bacterial of origin is when we see the Streptococcus mutans that we talked about in the last chapter coming from the mouth and moving into forming a secondary infection inside of the heart. Now I'm going to flip through a few of these slides and simply hit the high points. Tularemia is important because it's a zoonotic disease, meaning that it lives inside of a reservoir of animals, rabbits and ground squirrels. This particular infection is then transmitted when a tick or deer fly bites the animal and then bites a human. The most characteristic way that you know that tularemia is the suspect is you will see this ulcer forming at the site of the injection. Gangrene is caused by a bacterial infection in dead tissue. So first the tissue must die. Then you will see the microbe, the bacteria Clostridium perfringens, growing inside of the dead tissue. The dead tissue allows the Clostridium to grow rapidly, leading to gas production. Cat scratch fever is caused by the infection of a bacteria, typically following a cat scratch, and you will see this papule form at the site of injection. Now this is a disease that we do need to spend a little bit more time on, the plague or Black Death. The plague is caused by the bacteria Yersinia pestis. Now you may think this is not an infection we need to discuss. We don't see this anymore. But as you can see from this graphic below, this is the western portion of the United States. We do still see infections of the plague in the United States. The bacteria Yersinia pestis is transmitted from a flea bite. Often, the flea will bite an infected rat and then infect a human. The plague can be transmitted from human to human once the particular individual has had a severe enough case of the plague that it is living inside of the respiratory tract. The characteristic sign of the plague are these swollen lymph nodes that we call buboes. Progression of the disease will lead to dark areas of tissue death, hence the name Black Death. The next disease to discuss is Lyme disease. So we see something similar here where we have a vector transmitting the infection. And if you think about that, that's going to be common in this chapter because when a tick or some sort of vector bites, a lot of times, mosquito, a lot of times that's going to be direct injection into the bloodstream. With Lyme disease, the bacteria is injected by a tick bite. So the tick will bite a deer or some animal like that that has Lyme disease. And then the tick will bite a human, infecting the human with the bacteria Borrelia burgdorferi. The characteristic sign of Lyme disease is this bullseye pattern at the site of injection. Following the bullseye pattern, the bacteria can lead to infection of the heart, and it typically will take up residence inside of the joints, leading to severe forms of arthritis. The next topic in this chapter are hemorrhagic fevers. Hemorrhagic fevers are going to all be transmitted by mosquito bites. The mosquito bite will then infect and put the virus inside of the human's bloodstream, leading to kind of a wide variety, but typically because they're hemorrhagic fevers, it's going to lead to some sort of excessive bleeding. That's where the hemorrhaging term comes from. The one that has been in the news most recently is Ebola. Now let's take a look at some protozoan infections. The first one is Chagas disease. Chagas disease is a disease that has become important due to its location on the emerging infectious disease list. Chagas disease is typically a disease of Central and South America. However, this disease has been slowly migrating further and further north, and it is now on the emerging infectious disease list for the United States. Chagas disease is caused by the protozoan Trypanosoma. Trypanosoma typically lives inside of rodents, possums, and armadillos. The Chagas disease infection is transmitted by a bug known as the kissing bug. The kissing bug will take a blood meal from the oral membranes. While it's doing so, it will defecate in the same area. Humans will then scratch and move that contamination of the protozoan into the mouth or the eye, leading to Chagas disease. Chagas disease can ultimately lead to paralysis of the esophagus and the colon, large swollen abdomen, and eventual death if not treated. Our next protozoan disease is Toxoplasmosis. Toxoplasma gondii typically lives in cats. It is transmitted to humans when cats live indoors and use litter boxes that humans will have to fool around with the cat feces, or when cats that live outside, perhaps they bury and go in a kid's sandbox or something like that, and then kids will then play in the sandbox. That's why sandboxes have to be covered, and when you buy them now, they have a covering on them. Toxoplasmosis is not too bad of a disease for someone that's healthy, but a pregnant woman can get a toxoplasmosis infection, and that can lead to stillbirth or a baby born with severe neurological damage. A lot of women that are pregnant will have an obstetrician that tells them they need to make sure they don't touch cat litter while they're pregnant, and it's because of toxoplasmosis. Our next protozoan disease is malaria. Malaria is caused by the protozoan Plasmodium. Plasmodium is transmitted to humans by a mosquito. The life cycle of malaria involves a mosquito biting a human. This puts the protozoan in the blood. The protozoan then goes to the liver. Inside of the liver, the protozoan will complete zygogony. Remember, that is rapid multiplication. The protozoan will then leave the liver, infecting red blood cells to complete zygogony again. This destroys the red blood cells. Patients with malaria will have anemia and typically, ultimately, cardiovascular collapse due to this destruction of the red blood cells. The next protozoan infection is leishmania. A lot of times they use that word mania, but it's leishmaniasis. Leishmaniasis is characterized by a pretty nasty lesion on the skin, as you can see in these pictures. And then our last infection to discuss is actually a worm infection. It's an infection of the fluke called schistosoma. Schistosoma is spread by human feces or urine in a contaminated water supply. The fluke has to have an immature stage, and it can actually go into and bore into skin. The intermediate host of this particular infection is a snail. The characteristic sign of schistosomiasis is a swollen abdomen and bleeding of the urethra.